morning friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. So we were discussing about Asperger syndrome and criteria 1 we have already studied. Now what is the criteria 2 for the diagnosis of Asperger syndrome? Criteria 2 is this child has got restricted repetitive patterns of behavior and interest in activities as manifested by the at least two of the following. Okay, so there is insistence on the sameness, just like in the autism also we'll have insistence on the sameness, but it's a different issue because language and social is completely affected, but here it's not like that, but still he has got insistence on the sameness, sitting in the same place, sitting on the same bench, wearing the same dress, okay, going on the same route, like that. So insistence on the sameness and inflexible adherence to the routines. He cannot change the routine. Okay, getting up the same time. First he want to go for bathing, then he take the breakfast. So like that. So same pattern he will follow. Inflexible adherence to the routines or ritualized patterns of verbal and non-verbal behaviors or excessive resistance to change. He is showing very much resistance for the change. From the normal routine, if you want to change him, then he will be irritated. Okay, he will be disturbed. So he will go with the same pattern. Okay, he will be ready in time. 9 o'clock means by 9 o'clock he will be ready. And if you look at his pattern of his work, same pattern. There is no same in the same series he will do same day. Okay, so they don't want to change their routines. So they always want the sameness, and they always follow the routines consistently. Okay, some of the common words which provoke their agitation, so they use no, wait, change, and not fair, etc. Okay, suppose if you try to change their routine, then they use some of the common words. Okay, otherwise also in routine also, if you observe, for all type of communications, they use same words. Okay, so if you are doing some help for him, then always they will say okay, 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 or sometimes maybe thanks, thanks. So all the time, thank you very much, they will not say thanks, 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 always thanks. Okay, thank you, so kind of you. No, thanks. So that means same words also they use. When they get frustrated or agitated also, so they will be using the same words like no, don't change, wait, like this. That also with the expression less face. So this is another important thing. When there is a change, they hate. That means if you are making them change the routine pattern, then they will hate. Okay, or sometimes they may be panic about the change. Now another is highly restricted and fixated interest that are abnormal in intensity of the focus. Sometimes they will have hyper, or sometimes they will have hypo reactivity to the sensory input or unusual interest in sensory aspects of the environment. So they are restricted interest also. So they may be incredibly knowledgeable in such aspects of their interest like volcano, Minecraft, Pac-Man's, etc. games which is designed by them, and they go on talking about the same monotonously for hours together. Their interest on particular subject may last for hours together, days, or even for the decades. Now those kids who develop this interest for the decades together, suppose if they develop in some of the engineering work, some of the electronic work, and that interest remain in them for decades together, then they may be a very good personality in the field of electronic engineering, or maybe in the field of physics, or some cinematic or cinematography means they may be very good in that field, arts. Okay, so this interest they are having interest in the same field, that interest may last for days, months, years, or decades. So when it is last for the decades, definitely they will be an expert in that field. That's what I'm trying to tell. Okay, so they may be walking encyclopedia sometime in a given subject. Okay, suppose physics, chemistry, or mathematics, or some other arts, history. They know everything because it is their area of interest and they learn everything. and they can talk about that subject for hours together. They're just like walking encyclopedia. Okay, and many Aspergers comment that on a particular subject that this is waste of time. What I mean to say is, for example, many of us learn the Pythagoras principle, isn't it? And we learn and pass the exam, and then we will going to forget it. And we never sure it is practicality in the life. We learn that, we pass the exam, and we never thought when it will be used in the practical life. But when you are teaching this particular Pythagoras principle to an Asperger's kid, he will say, what is the use of it? How it is applied? This is totally a waste of time. Okay, this is the problem. He is not interested in that field. So then he always asks this question: why you have to study? Where it is used? What is the practical applicability? You cannot say this is wrong. You cannot say this is wrong. But thing is, to pass the exam, you have to read that, isn't it? And when it is practically usable, that the time says in future. But this kid is not ready to accept that. He will ask there only. So if it is of no use, why have to study? That's all. He will leave it. So another issue with the Asperger syndrome is sensory sensitivity. Now, auditory, sudden or sharp noises or sharp pitch sound, etc. Many times when you ask which teacher you like more, okay, suppose if you ask a question with Asperger's baby, which teacher you like more, he say, I hate the teachers who shout. Many times child don't want to go to the playground. Not that he is socially back, because he hates shouting, because in the playground the students are shouting, kids are shouting there. So this man of Asperger syndrome has got sensory sensitivity, so he don't want this shouting. Therefore, to be away from that, he will keep alone in the class. Okay, so along with the social communication problem, he also have this problem also. Now, few of the kids may have this problem, few may not have. Okay, so in this case, he is not going to the playground not because of social interaction problem. He is not going because he don't want shouting. Similarly, tactile sensation is also sometimes problem. Many times he becomes isolated. These kids are become isolated because in a crowd, when the kids push each other, so they will touch, isn't it? But this man is hypersensitive about touching. I don't mean to say that these all symptoms will be seen in all the kids. Okay, so in some of the kids you can find this also. So therefore he is keeping away from that particular crowd. Most of the time he also about the birthday party. Balloons, they will burst and it will touch the body parts, and they are reluctant to wear the ties, neck sensitivity, etc. And even they are irritated by the tags. Okay, in the birthday party you will wear so many topies, caps and this neck bands and all those things. But because of this hypersensitivity problem, these kids don't like that. See, these are some of the issues that these kids will have. Similarly, some of the visual problems will be there. See, visual sensory problems will be there. Many times teenager bunk the teacher's class. So when you ask why you are bunking the class, he says that the teacher teacher used to wear bright saris, which I don't like. See, very typical. Okay, here the problem is not with the teacher, and the problem is also not with the social communication, the hypersensory sensitivity of this particular kid of Asperger syndrome. Sometimes aroma, smell, perfumes and all. Teachers smells and use the perfumes many times, teachers, friends or anywhere. But this guy don't like that, therefore he is bunking the class. Okay, sometimes sensation related to proprioceptive system, position and movement of the body. This is also a problem. Sometimes pain, sometimes so many other proprioceptive sensation, position, etc. See, we need to understand this problem. Otherwise, if you are not studying the disease, how you can understand this problem? We find such kids in and around us daily. Okay, he may be also a case of Asperger syndrome, may not be with all the symptoms, but with a few symptoms. Of course, it is not dangerous. We can manage it. But at least we have to identify it, isn't it? So thank you very much. In the next class, we will see the criteria 3 of Asperger's syndrome. Till then, goodbye. Thank you very much.